Okay, so maybe you've heard mixed messages. One doctor says hormones are dangerous, another says you've started them years ago, you should have started them years ago. Maybe you're confused, maybe you're cautious, but you just want to feel better, but you want to do it safely. Well, let's clear things up concerning hormones for vaginal and bladder health. I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine doctor and owner of InTouch Primary Care in Sugarland, Texas. And you're listening to Connecting the Dots with Dr. Ashaye. So if you or your loved ones are in Texas and you've been putting off health care because you're frustrated or you're seeking a more personalized approach to your health, check us out at InTouch Primary Care. We're dedicated to making high-quality health care both accessible and stress-free. So let's talk about safety. So this is a series we've been doing on vaginal and bladder health and hormones and how that affects it. And in terms of safety, if you hear nothing else from all that we've talked about over this is our fourth week talking about it, please hear this. Vaginal estrogen are extremely safe. Vaginal estrogen and other vaginal hormone treatments are extremely safe. They are not systemically absorbed in significant amounts. They're not associated with risks of breast cancer, blood clots, heart disease, or stroke. They're even considered safe for people with a history of breast cancer, and there are several FDA-approved options, some of which are bioidentical. Okay, so there are many reasons why you can use this medication safely. They're designed to act locally, right at the tissue level, so they do not raise your estrogen significantly throughout your body. It is targeted relief for dryness, burning, itching, urinary symptom, painful sex, and other symptoms that people experience because of the low estrogen that occurs in different stages of life. So if you've avoided treatment because of fear, please talk to someone who's knowledgeable about this. You're likely to have options for safe, effective options that can really make a huge difference in your relationship, in your health, and in your overall quality of life. So don't hold back, ask for help. And if you are in Texas, in the Texas area, contact us at InTouch Primary Care. We'll be happy to help. A question, though, that we get is, okay, so does treating these vaginal symptoms, does that help with libido or desire or having orgasms? Well, here's the deal. Vaginal estrogen or vaginal hormone treatments improve tissue health. They improve moisture and comfort. So that can make intimacy more enjoyable again. And it can indirectly boost desire, but it doesn't directly increase libido. It will make it less painful, and usually that helps with connection and interest. But there are other options for that for libido. The intrarosa, which is the DHEA insert that I talked about earlier, and Ospina are exceptions to that. They can support desire by improving blood flow and tissue response. So they can give a little, but that's not going to be the main treatment for libido and desire. Okay, so I want to also briefly talk about non-hormonal options because there are some people that maybe they can't use hormones, which is a very small population of people who may not be able to use vaginal hormones of women. Majority of women can safely use this effectively, including women that have had breast cancer. Or maybe you just prefer not to. You just want to add on non-hormonal treatment to your hormonal regimen. So other options are vaginal moisturizers that can help restore moisture and elasticity. Remember, it doesn't really treat the root cause, but it can help to make intimacy a little bit more comfortable. So there's some brands like Replens and Good Clean Love that you can check out for moisturizing the vagina. Remember, it's a tissue, it's skin, and so it may need to be moisturized if you lost the hormones that usually act like a natural moisturizer. Lubricants can be helpful during intimacy or when we do exams, pelvic exams, we use lubricants there as well because it makes the exam a little bit more comfortable. They can be water-based, which is easy to clean, but usually you have to apply more often. They can be silicone-based, which lasts longer, especially helpful for people that have painful sex. Generally speaking, you probably want to avoid lubricants that have glycerin in it because it can cause irritation. Another thing that could be helpful is pelvic floor therapy, and that's because it can improve the tone of the pelvic floor, it can improve circulation and nerve connection. So that can help with discomfort, can help with leaking as well, and can make sex more enjoyable. Other things that can be helpful is hydration, reducing alcohol, and obviously, avoiding smoking. That can help as well. Increasing omega-3 and phytoestrogens like soy, nuts, and flaxseed, that can be helpful. Stress management is always a good thing to lower because cortisol affects our hormones and can also affect our desire and need for intimacy. The last thing that could be helpful is, paying attention to mindfulness and relationships and just the biopsychosocial aspect of intimacy. And sometimes that includes therapy. There's some apps that can be helpful, and there are other specialists that could help with working on relationships and emotional desire and sexual desire. So the point is there are options. There are hormonal options, there are non-hormonal options, there are vaginal estrogen options, there are non-estrogen options. So there are options. So if you are in Texas and you want care that sees the full you, go ahead and visit us at intouchprimarycare.com. You can call the number in the description as well. But also, share this with a friend. Maybe they're not here in the Texas area, but they also need help. They can find a specialist in their area. And don't forget to subscribe. And we've just scratched the surface. There's so much more. So I hope this has helped so far.